glycogen storage disorder. So these are actually inborn errors of metabolism which are related to the glycogen and its storage and metabolism. What is glycogen? Glycogen is a storage form of carbohydrate in our body. What are the organs involved in storage of glycogen? Very good. Muscle and liver. Majority, to small extent, kidneys, brain, etc. Right? Now, what is the role of glycogen in our body? In between meals, it maintains blood glucose level between two meals. সকালবেলা ব্রেকফাস্ট করলে, দুপুরে তুমি লাঞ্চ করছো, মাঝখানে তোমার 4 থেকে 5 ঘন্টা গ্যাপ, এর মধ্যে ব্লাড গ্লুকোজ মেনটেন করবে stored glycogen in liver but not in muscle. What is the difference between liver and muscle glycogen? The major difference is that liver glycogen contribute to blood glucose level for maintenance, but muscle glycogen cannot. Why? Because they lack one terminal enzyme of glycogen catabolic pathway called glucose 6-phosphatase. Muscle has no glucose 6-phosphatase. Then what is the role of glycogen in muscle? To provide energy for muscle contraction. Correct? Now, in glycogen storage disorder, the list is not as small as this, but these are the least you must remember. So first one, this is the mnemonic VPCAM HD. Okay, type 1, 2, 3, 4, 5, 6, 7. Okay, khata likho, writing na? Now you remember the names. V for von Gog's disease, P for Pompe's disease. Check out the spelling. As I go on telling, check out the spelling. Pompe's disease. C for Cory's disease. In some books, you'll find other names also. In beside Cory, they'll write Forbes disease. F-O-R-B-S. Forbes disease. Okay. Why? Because this was initially they were classified like this. Later on, they found they have got some sub-classification. So then they like 2A, 2B, 3A, 3B, like that. A for Anderson's disease. Check out the spelling, not Anderson. Anderson. Like Swiss footballers. M for McArdle's. H for Haar's. But it happens with his also. So Haar's disease, these are names of the scientists who discovered. That's all. Haar's disease, and then Tarui, Japanese person, Tarui. The third column is the defective enzyme. Check out the defective enzymes now. If you are writing along with me, you will remember how to remember. First you remember how to remember, then you remember what to remember. Is it not? You have to remember it. You have to by heart it. Every disease, every metabolic disorder you have to remember. You find your own path to remember. This path I am showing. Other paths you find your own self. Fine? So, enzyme deficiencies, glucose 6-phosphatase. What happens there if glucose 6-phosphatase is not there? The free glucose will have to be produced. Now, this glucose 6-phosphatase enzyme is already deficient in muscle. So, muscle has no involvement in type 1. If the question comes like this, why muscle has no involvement in von Gog's disease? Because already it is absent. Pompe's disease, the enzyme deficiency is acid maltase or acid alpha 1,4 glucosidase. Shorter name is acid maltase, longer name is acid alpha within bracket 1, 4 glucosidase. Okay. Third one is Cory, deep branching enzyme. Then next is branching enzyme. Then M, McArdle's disease. M for muscle phosphorylase deficiency. है ना? देखो, है ना? After muscle comes liver. Next is liver phosphorylase deficiency. Tarui. What is that? Tarui is something different. See, check out. That? Something different, which is not directly related to the. What is that? Of muscle PFK1. Right? Muscle PFK1. And last one, you will thak 8 number thak. है ना? Liver phosphorylase আছে আবার পরে muscle phosphorylase আছে। যাও। হলো? তাহলে up to Tarui, clear? So now we know the type 1, type 2, type 3, type 4, type 5, type 6, type 7. Now we know the names. Monarchis, Pompes, Corys, also called Forbes, Anderson, McArdle, Haas, Tarui. Enzyme deficiency, glucose 6-phosphatase, acid maltase, debranching enzyme, branching enzyme, muscle phosphorylase, liver phosphorylase, muscle PFK. Clear? Now, the symptoms. First we come the symptoms. The type 1 has got largest. Because it was discovered first. See, 2 and 4 are fatal. 2 and 4 are fatal. The person will die. 2 within the age of 1 year. 4 within the age of 2 to 3 years. Remember, 2 has got different subtypes. Pompe's disease has got many subtypes, infantile, juvenile, adult also. But mostly, the most fatal occurs in the infantile. Within the age of 1 year, they die. And they die due to congestive heart failure. Number 4, what is number 4? They die due to, by the age of 2. So 2 and 4 are fatal. 2 dies due to heart failure, congestive heart failure. 4 die due to liver failure. Correct? Now for all diseases, there is only one common symptom. What is that? Hypoglycemia. Okay? Because glycogen is not broken down properly, so hypoglycemia is second. Now we come to the type 1. Check out the symptoms, read out. First one is hepatomegaly. Why? Because accumulation of free glucose. Glucose is trapped inside the liver in the form of glucose 6-phosphate. So glucose 6-phosphate, unlike free glucose, are osmotically active, more osmotically active molecule. So they will draw water inside the liver. So the liver will become like my belly. Not like that. You can palpate the liver. You can palpate the liver that it is hard. When the abdomen is soft, that means liver is normal. When the abdomen is hard, hypogastric region, that means liver is swollen. Have you seen the palpation that started? No. So we'll see that when you palpate it, that means it is soft. But when it's really very hard, then you will make out that something is not right. So that is due to hepatomegaly. So hepatomegaly is a symptom for many diseases, but this is a symptom for also this disease. Check out the age. What is the age? Normally they are juveniles. juveniles, 8, 9, 10, 11 12 year old, they will come. Sluggish, hypoglycemic will be there, and failure to thrive, lifelessness, not lively, lack of energy. Babies lack of energy, and they will show hypoglycemia, they will show hyperlipemia, and they will show hyperuricemia. Now we will discuss everything, each of the point, because each of the point may be asked separately in the examination. Why there is hypoglycemia? First point, why there is hypoglycemia in type 1 GSD? Question. What is the answer? Free glucose is not released from liver. When you are eating the food, then food excess glucose gets stored in the liver. Right? Now I have taken my breakfast around 8:30. Now it is around 11:30, 3 hours. So whatever circulating glucose was there, it was already consumed. Now if I am walking and talking and respiring, why? Because my liver glycogen is able to break down glycogen and release it in the form of free glucose in the blood. If it cannot release in the free form of glucose, then it will remain trapped in the liver. So what will happen? Hypoglycemia is outside, in the blood, and hyperglycemia inside the liver cell. So even though I have taken a lot of breakfast, doesn't matter how much I have taken, I'll again be hungry. So what is a remedy? Go on sipping glucose continuously. Actually, this is managed like this. There is an instrument they carry in the backpack, which contains one monitor, which monitors the blood glucose level. As soon as it falls below 60, immediately it pours glucose solution, IV. And throughout the day, the person can walk and person can live a long life. But provided whenever he is sleeping also, that time also he has to be given IV, intermittent IV supply. So this can be managed by this. There is no cure. Only management is there. So hypoglycemia is due to because they cannot release the glucose from the liver. Next point you take. Ketosis. If there is no glucose in the blood, the body will sense what? Body will sense like we are in diabetics. In diabetes, what happens? Insulin is not, glucose is not there. Glucose is there, but we can't see glucose. So what will happen? Lipid breakdown, beta oxidation, excess of ketone body. That much ketone body we cannot utilize. Excess ketone body will cause to ketosis. Hyperlipemia. See, hyperlipemia last is also explained in the same ketosis. Now, what is left? Last one. Why there is? What does it mean? Hyperuricemia. What does it mean? Ekjon bolo, 1%. Excretion. Anyone else? High uric acid in blood. Mia, M-I-A, Mia. Urea means in urine. Mia means in blood. Hyperuricemia. Elevated level of uric acid in blood. What is uric acid? The end product of purine nucleotide catabolism. Yet to be taught. Purine nucleotide catabolism. And uric acid is usually should be excreted thoroughly, clearly through urine. But what goes wrong that in this case, uric acid level increases. The sense is uric acid is an acid which is excreted through urine. But how? There must be some transporter molecule which will pour uric acid from kidney to the renal tubule, luminal side of renal tubule. Some transporter, some pore, something will be there. So there is a common transporter which transports all acids. When there is hypoglycemia, there is another organic acid increases in our blood which causes acidosis. What is the name of that acid? Hypoglycemia leads to organic metabolic acidosis. Correct? What is the acid due to which blood pH decreases? Lactic acidosis. Hypoglycemia leads to acidosis due to accumulation of lactic acidosis. Lactic acid and uric acid, they both compete for excretion through the same transporter. Lactic acid and uric acid both compete for excretion through the same transporter. Now, if suppose imagine him as uric acid and me as lactic acid. If we compete to go out through this door, who will win? Who will win? Me. I am more powerful. So by the grace of nature, lactic acid is preferred over uric acid for excretion. Lactic acid is preferred over uric acid for excretion. So uric acid concentration increases in the blood due to not increased production, but due to less excretion, or other way, increased retention. Right? So that is the cause of hyperuricemia. Now, yes, as I said, like this is a uncommon sense. A lot of knowledge is involved here. What is the common sense would have worked here, which you failed to answer? The common sense is given in many books, which I beg to differ. I do not agree with that. Many books have written, the other side of the story is something like that. Because there is hypoglycemia, the end product of glycogen metabolism or catabolism in liver, in this case, is glucose 6-phosphate. Glucose 6-phosphate is the starting material for many other pathways. Can you name one? Yes, HMP shunt or pentose phosphate shunt pathway. What are the products of pentose phosphate pathway? Pentose phosphates. What are the use of pentose phosphates? For synthesis of nucleotides. If the nucleotides are produced more without any role utilization, what will happen? They will break down more. They will produce more uric acid. So the answer in this way is due to increased production of uric acid. And what I answered before, due to increased retention. You got to choose. You choose my one, the first one answer. Okay. If any examiner comes to duel with you with the later answer, then always remember it is the examiner who will give marks to you, not the other way around. So always be submitted. Yes, sir, you are correct. You are right. Remember, there are two golden rules. Boss is always right. Rule number 2, when boss is not right, what to do? Follow rule number 1. Follow rule number 1. Follow rule number 1. So remember, never go into duel with, particularly when they are giving marks in the examination. So, but you learn what is the correct one. The correct one I told you. This is the correct answer, no doubt. I have no doubt. Right? So that's all for type 1 GSD. Okay? Let's talk about something about which one? you want me to say? Little later I will see. Let's do something about McArdle's disease. This is a bit unique one, nah? It's unique. In this McArdle's disease, is limited ability of strenuous exercise. Means if you ask a person to walk on the treadmill, he or she will fail to do so. Very fast, rapidly, the person will become tired. But whenever we have seen, whenever an object on an organism gets tired, and an animal or whoever this person gets tired, his blood pH decreases. Why? Because of, in this case, that won't happen. The person is dog tired, cannot work any further, and will complain about muscle cramps. Then you measure the blood pH, and the pH will be same, not decreased. It will not decrease even after 10 minutes, 15 minutes. Why? Because lactic acid, they formed inside the muscle, cannot escape. Cannot escape. Karan, glucose is produced less. So muscle's normal function will be reduced. Muscle phosphorus is absent means glucose is produced less. So muscle cannot function. So it will not produce whatever small amount of decrease will produce, it will remain. Lactic acid has nothing to do, because it will cramp because of lack of glucose, not due to accumulation of lactic acid. Muscle is very efficient to how to get, they know very efficiently how to get rid of lactic acid. It is vastly populated by blood vessels. You don't worry about it. Only thing is, we cannot run like Usain Bolt because we are not trained. You get yourself trained, Usain Bolt cannot think like me. I cannot run like him. So like that. Okay. So it is due to lack of glucose. Fine. What else? Now we will discuss some clinical cases, case studies, okay, from this book. I would advise you to write down and then discuss. A 3-year-old female child was admitted with progressive abdominal distension for past 8 months. 3 বছর বয়স, 8 মাস ধরে পেট ফুলে যাচ্ছে, এরকম কমপ্লেন নিয়ে ভর্তি হয়েছে। A 3-year-old female child was admitted with progressive abdominal distension for past 8 months. Stop. Mother reported that baby has difficulty in walking and gets easily tired while playing. Mother also reports when the baby gets very restless, and sweats profusely early morning, feels comfortable and go to sleep if milk or fruit juice is given. Correct? Stop. On examination, the child was found to have motor retardation, and was small for age. Delayed developmental milestones, small for age. Liver was found to be enlarged and margins were 10 centimeter below. Margins were 10 centimeters below the coastal margin. The coastal margin with firm consistency. এই যে এখানে শক্ত, না বললাম না অ্যাবডোমিনাল ডিস্টেনশন হবে। Investigation showed AST 345 units per liter, ALT 234 units per liter, ALP alkaline phosphatase 221 units per liter. AST 345, ALT 234, ALP or alkaline phosphatase 221, 221 হলো। Next, total bilirubin T dot bil, BIL. Total bilirubin 1.8 mg per dl, 1.8 mg per dl. FBS, fasting blood glucose, below 60, 56 milligram percent. How? Total bilirubin 1.8 milligram per dl. তারপরে FBS, fasting blood sugar বা fasting blood glucose, FBG তাই বলো, 56 milligram per dl. Morning sweating, profuse sweating, restlessness, hypoglycemic. One of the commonest symptom for hypoglycemia is sweating. So he was sweating and he was given juice, so he was fine. Had it been due to hyperglycemia, given juice, he would have been gone to coma. জুস দেওয়ার পরে সোয়েটিং কমে গেল, ভালো বেটার ফিল করছে, তার মানে হাইপারগ্লাইসেমিয়া হয়েছিল। কিন্তু মনে করো যদি হাইপারগ্লাইসেমিয়ার জন্য, হাইপারগ্লাইসেমিয়া সেম সিমটমস, সোয়েটিং, রেস্টলেসনেস, সোয়েটিং। But if you give more sweet, what will happen? The patient will collapse. But here patient is happy, sleeping. What else? Enlargement of liver, abdominal distension, yes. What else? The liver enzymes all are elevated, AST, ALT, alkaline phosphatase, because liver is affected. When liver is swollen, that doesn't mean liver is happy. Liver is unhappy. The cells are under immense fluid pressure. It cannot function properly. So the normal enzymes are leaking. So liver is in distress. Distension shows distress of liver. Right? So liver shows distress. So liver enzymes increases. That means liver is being damaged. Liver is being damaged. Correct? So it is type 1 GSD. Very good. Wow. It was so difficult. Next one. Again, far more difficult one. Let's see how you cope up with this. Number 2, a 12-year-old boy presents to the OPD. A 12-year-old boy, 12-year-old boy comes to OPD with decreased exercise tolerance. Decreased exercise tolerance. Muscle biopsy shows high content of glycogen. Muscle biopsy shows high content of glycogen. এবার এখানে একটা প্রশ্ন আছে আমার। What is the normal content of glycogen in muscle? Muscle can store up to 1% of its weight in the form of glycogen. Up to 1, মানে it is below 10, below 1 normally, তাই না? And liver can store up to 10% of its weight. তাহলে যদি 1 কেজি লিভার হয় কতটা থাকবে? If the liver weighs around 1 kg, then how much glycogen it can store? If the muscle weighs around 45 kilo or 50 kilo, then muscle mass is more or liver mass is more? Yeah, muscle mass is more. Yeah. What about the fat person? A very thin person like him, and a very fat person like me. Who will survive? Who will have more glycogen stored in the liver? Huh? He. Who will store? He will store more glycogen in liver, or me, or I will store more glycogen in liver? Huh? Louder. Me. Why? Me being big, my liver is also big. So our body expenditure is also high. So both will last same amount of time. Me might last for less amount of time than him. Because his body is small, his requirement is less, my body is bigger, but liver is same. Almost same. Because weight of the liver does not depend on weight of the body, but the height এর উপর নির্ভর করে। দেখ লিভারের ওজন হাইটের উপর নির্ভর করে, তাই না? একটা বাচ্চা মোটা হলে তার লিভার বড় হয় না, হয় কি? লিভার মাত্রা একই থাকবে। ফাইন, তাহলে মাসেল বায়োলজি শোজ হাই কন্টেন্ট অফ গ্লাইকোজেন অ্যারাউন্ড 4%। এটা বলার জন্য বললাম যে 4% যে হাই সেটা বোঝানোর জন্য, অ্যারাউন্ড 4%। ঠিক আছে। অন এক্সামিনেশন it was found blood glucose 100 milligram per dl মানে normal, blood lactose 0.03 millimoles per liter, lactate 0.3 millimoles per liter lactate. Blood pH normal 7.4 after exercise. What is your verbal diagnosis? McArdle disease. Okay, so now here you have to explain that due to absence of muscle phosphorylase, muscle glycogen cannot be utilized for muscle exercise. Correct? Due to lack of glucose, muscle exercise will be stopped. So it will not produce lactic acid anymore. So muscle cramping is not due to accumulation of lactic acid, but due to lack of glucose. মনে থাকবে? A 4-month-old child. Number 3 case. A 4-month-old child comes with history of rapid heartbeat. এটাকে এক কথায় কি বলে জানিস তো? Rapid heartbeat and restlessness. Stop. Next line. He was hypotonic. T-O-N-I-C. Hypotonic and had hepatosplenomegaly. A 4-month-old child comes with a history of rapid heartbeat and restlessness. Stop. He was hypotonic and had hepatosplenomegaly. Stop. He was diagnosed to have cardiac failure. কি করে বুঝলো কার্ডিয়াক ফেলিয়ার? ইসিজি করে, তাই তো? ইসিজি দিয়ে বুঝতে পারবে কার্ডিয়াক ফেলিয়ার। And was put on diuretics and ACE inhibitor. Diuretics, when put on diuretics, diuretics, URETICS, diuretics and ACE inhibitor. অ্যাসিটাইল কোলিন এস্টারেজ, শর্ট ফর্মে লেখে ক্যাপিটাল এ, ক্যাপিটাল সি, ক্যাপিটাল ই, ইনহিবিটার্স। ঠিক আছে, স্টপ। চেস্ট এক্স-রে শোড ventricular hypertrophy. Ventricular hypertrophy. What is the probable diagnosis? Pompe disease. তাহলে এখানে যেটা প্রধান পয়েন্ট, মেইন পয়েন্টটা হচ্ছে কনজেস্টিভ হার্ট ফেলিয়ার। তাহলে আমরা যদি জানি কনজেস্টিভ হার্ট ফেলিয়ার হলে কি কি সিমটম হয়, কি তার ডায়াগনস্টিক প্যারামিটার এবং বয়স, এবং আরেকটা কি আছে হেপাটোস্প্লিনোমেগালি, তাহলে আমরা বলতে পারবো এটা হ্যাঁ, ঠিক আছে। এবং অবশ্যই পেশেন্টের বয়স, যদিও এর তিনটে সাবফর্ম পাওয়া যায়, একটা ইনফ্যান্টাইল, একটা জুভেনাইল আর একটা অ্যাডাল্ট, কিন্তু অ্যাডাল্টগুলো মেইনলি খুব রেয়ার, জুভেনাইলটা খুব রেয়ার। মোস্ট কমন হচ্ছে সারা জীবনে হয়তো তোমরা একটা টাইপ 1 GSD দেখতে পারো আর একটা ম্যাকআর্ডলস দেখতে পারো, বাকিগুলো দেখতে পারবি না বলতে পারছি না। ভেন্ট্রিকুলার হাইপারট্রফি হলে কি হবে, তুই যখন এক্সরে করছিস, এক্সরেতে হার্টটা বড় দেখাবে, তাহলে হাইপারট্রফি হয়েছে। এবার সামনের দিকে কোনটা থাকে, লেফট ভেন্ট্রিকল থাকে, হ্যাঁ, তো লেফট ভেন্ট্রিকল বড় হলে আমরা দেখতে পাবো আগে সামনে থেকে, পিছনে সাইডটা থাকে, রাইট ভেন্ট্রিকল পিছনে থাকে, তাহলে আমরা দেখবো যে লেফট ভেন্ট্রিকুলার হাইপারট্রফি দেখতে পাবো। তার মানে হাইপারট্রফি কখন হয়, যখন লিভার হার্ট ইজ ল্যাডেন উইথ লট অফ ফ্লুইড, মানে অনেকটা ব্লাড যখন পাম্প করতে, তাকে তো কনজেস্টিভ হার্ট ফেলিয়ার বলে, তাই না।